Oftentimes people will complain of neck pain, and this is the basic exam that we'll do. In addition, with patients who complain of shoulder pain, we'll often examine the neck as well. So if the chief complaint is shoulder pain and the clinician is examining the neck, be sure to capture that so that we know that we have examined that and ruled that in or out. So I'll just start by demonstrating the exam, and this isn't about trying to learn the exams for how to be a physician. This is trying to capture the information of the clinicians as they're doing these exams, and they're doing them quickly. Again, another reminder that in the clinic, when we're live, the physicians will usually only call out the positive findings and not the negatives. So if they examine an area but they don't call anything out, then that means it's negative and mark it as such. In this part of the exam, it'll be our first introduction into motor strength, reflexes, and gross sensory. These three things will be repeated for the lumbar spine. I'll just do a brief introduction on that. For motor strength is graded on a 0 to 5 scale. 5 out of 5 is normal, 4 out of 5 is not, and it goes down from 5 out of 5 to 0 out of 5. So basically, when we're assessing whether or not somebody can resist our pressure, they have to be able to resist gravity. If they can do that, that's a 3 out of 5. 4 out of 5 would be they can resist gravity, but they can't resist the practitioner. 5 out of 5, they can resist gravity and they can resist the practitioner. When we're doing the exams, we'll be testing muscle strength. If we call anything out, then we'll tell you 3 out of 5, 4 out of 5, 2 out of 5. If we don't, assume it's 5 out of 5. For reflexes are a 0 to 2 scale. 2 is normal. If we test reflexes, as I'll demonstrate in a minute, and we don't say anything, assume that it is a 2, which is normal. For gross sensory, we're going to ask the patient if they can feel the palpation the same on both sides. If they can, then it's normal. If they can't, then we'll document where that is. And usually that'll be documented in a dermatomal fashion, as in if they are numb here on the right side but not on the left, that is T1 distribution. So we'll say decreased sensation T1 dermatome right compared contralaterally, something like that. So let's get to the actual exam. So we'll start with cervical range of motion. So Rob, can you bring your chin to your chest? Great. Any pain with that?
No.
Okay. And then how about extending back? Any pain with that?
No pain.
Now on that one, he had a little bit of a limited extension, so I'd call that out in the exam. And looking over your right shoulder. Great, that's normal. Over the left shoulder. Very good. Can you go ahead? So we did the range of motion. Now we're going to test his muscle strength. Can you flex like this for me? Great. Resist me pulling down. Resist me pushing in. Resist me pulling down. Resist me pushing in. Great. Now with your elbows like this, flex your wrists up like that. Don't let me pull down. Very good. Don't let me pull down. Now we're going to flip that over the other way. Don't let me pull down. Don't let me pull down. Great. And then hands out like this. Don't let me push your fingers together. This one's not fair. The clinician has a big advantage. So what we tested, so good job Rob, we're done there. So what we tested was elbow flexion, elbow extension, wrist flexion, wrist extension, and finger abduction. So those were all normal, so I didn't call anything out, so you would mark those all negative. When you look at the IMS flow for the basic exam for muscle strength, there will be other muscles that can be tested. We generally don't test all of them, so you'll need to be sure that you mark only the ones that we do test. Now we're going to move on to reflexes. So Rob, just give me your weight here. Just relax your arm. Great. So here, that's the triceps. Here is the biceps and the brachioradialis. So we did all three of those. They were all normal, so you'd mark those as normal. Usually I'll test both sides, but I think you get the idea. So now we're going to get more specific. So those are general things where we're assessing the neuromuscular intactness of the patient to see if there's any major red flag symptoms. Luckily, Rob doesn't have anything major going on. But now what we're going to do is kind of try to narrow in and help use our exam to help us with the diagnosis. One of the tests that we'll do is called Sperling's test. And this test is particularly indicated for people who have neck pain that goes down their arm. So what we're trying to do is reproduce that symptom. So what I'm going to do is I'm going to ask Rob, can you look up into that corner of the room? Great. And I'm just going to reposition you a little bit to the side here. I'm going to apply some pressure straight down. Let me know if you have any pain or symptoms going down your arm. Okay. And look over that way. And again, I'm going to reposition a little bit and push down. Any symptoms?
No symptoms.
Okay, great. So that's called Sperling's, and it's negative bilaterally. As you're charting the exam, it's very, very critical that you pay attention to laterality. So laterality is right versus left. We don't want to be injecting a right cervical facet when their patient's symptoms are on the left. So try to be as accurate as you can with that. Throughout the exam, if you have a question of the clinician, did you examine this, or where are you when you're examining that, just ask them. So next what I'm going to do is palpate the cervical spine. So I'm going to check for trigger points in his cervical musculature or paracervical musculature. Any tenderness through here? In through here? Great. So as far as trigger points, I didn't identify any. As far as hypertonicity of his paracervical muscles, paraspinal muscles, I think is what it says in the basic exam, that's negative, but we examined them. Now we're going to move out a little further to the side. So the musculature is going to be more central, and then a little further out to the side we're going to be assessing the cervical facets. Tenderness there.
No tenderness.
There.
A little bit of tenderness there.
Okay. So tenderness at left C3-4. Down here.
No.
Down here.
No.
Okay. Now I'm just going to assess the other side of the facets. It's easier to move to get a better angle. Tenderness through here.
No.
Here.
No.
And there.
No.
Great. So the right-sided facets are non-tender to palpation. The last area that is not necessarily in the flow, excuse me, but sometimes will be examined is disc space tenderness. So for that one, I'm going to go very centrally, and I'm going to palpate each level of the cervical spine. Any tenderness through there?
No tenderness through there.
Great. All right, so that is the basic flow of a cervical spine exam. I did forget one area, so let's backtrack. When I did the reflexes, usually the next thing that we examine is for sensory. So just go ahead and put your arms out like this. Can you feel this symmetrically on both sides?
Yes.
Any decrease in sensation in any of these areas?
No.
Through here?
No.
In through here?
No.
Through here?
No.
Okay, so gross sensation is negative. So that completes the cervical spine exam.